Hello again. The thumbnail to this video shows an advertisement for a post in the NHS in Bradford. It is for a close relationship marriage nurse stroke midwife. This post will be dedicated to clearing up some of the health problems caused by the propensity of people in the Pakistani community in Britain to marry their cousins and sometimes even closer relatives. Marriages between cousins, although legal in most countries, are sometimes looked at a little askance as tending slightly towards the incestuous. The disapproval sometimes evinced is perhaps associated with the increased risk of genetic problems being passed down. It is worth noting that until Henry VIII wished to remarry in the 16th century and got a papal dispensation, cousin marriage in this country was prohibited by both church and civil law, for good reason. Over half of all marriages in Britain between people of Pakistani heritage are between either first or second cousins. Cousin marriages are a terrible idea, and although legal in Britain, are the object of a popular taboo as steering much closer than is comfortable to incest. Very few marriages in Britain between white people are between cousins, roughly 1 in 25,000. The chief reason that cousin marriages are undesirable is that they hugely increase the chance of any offspring being sickly, dying young, or suffering from some genetic defect or other. One remembers the royal families of Europe who were in the past very fond of this practice. The British royal family too fell victim to the perils of inbreeding within a small group. When one person is a carrier of a defective gene, such as that for sickle cell or haemophilia, then there is a risk not only of passing this on to children, but if such a person has children with a person who shares the trait, then the full-blown syndrome may result in their offspring. Of course, if you and your relatives have for centuries been marrying each other, then traits such as haemophilia may become more common than in the general population. Queen Victoria carried the gene for haemophilia and married her cousin Albert, who was also a carrier of the gene. This led to one of their children, Leopold, being born with the disease itself. He died from a hemorrhage after a fall. Because Victoria's children married into the other European royal families, the disease showed up in the Russian and Spanish royal families too, most famously with the son of Tsar Nicholas, who died in the aftermath of the Russian Revolution. Approximately 3% of the British population is of Pakistani heritage. That is to say, people who were either born in Pakistan or are born to parents whose families have their origin in the country. The infant mortality rate among members of this community is double that of white British babies. A shocking figure indeed. The infant mortality rate for babies of Pakistani origin born in Britain is combined with a very high number of stillbirths in which the baby is born dead. This too is running at twice the national average. Not only that, but babies born to parents of Pakistani heritage account for a third of all babies with genetic birth defects in Britain. Reflect just for a moment on this figure. 3% of the population have 33% of the babies with genetic defects. A baby born to parents of Pakistani heritage is roughly 10 times more likely to be born with genetic defects, which in many cases lead to disability and a shortened lifespan. In 2014, the results of a research project into the alarming number of young children dying in the Midlands city of Birmingham was published. The report of the work, which was carried out in large part by the Enhanced Genetic Services Project, under the auspices of the National Health Service in Birmingham was absolutely shocking. It was found that the rate of stillbirths and infant deaths, definitely or probably due to cousin marriages between people of Pakistani heritage, was 38 times as high as that of white British babies. In the description to this video, I give references to these figures so that people can, if they're so minded, read up on the matter for themselves and see whether or not I'm being truthful or whether I'm exaggerating or inventing things. This is the background to that advertisement for a close relationship marriage nurse. The cost to this country of dealing with the effects of such marriages among the Pakistani community is simply immense. It includes catering for needs, both medical and educational, of a third of the children in this country born with genetic defects. Many of them have learning difficulties and physical problems entailing operations and endless hospital treatment. We could slash this expenditure by the National Health Service by a third if only Pakistanis living in this country could be persuaded to stop marrying their cousins. This is to say nothing of the close relationship married nurse whose salary we will be expected to pay, of course. When people deliberately embark upon a course of action which is likely to harm their children, then there is perhaps a limit to the amount of sympathy which we might be inclined to feel for them. Their suffering, and those of the children, are not the workings of random chance bringing misfortune haphazardly to a family. Rather, it's an easily foreseeable consequence of their folly. I, for one, resent having to shell out so many millions of pounds just so that a community in this country is able to follow some mad custom which has long been abandoned in most of the world. Cousin marriages are really only a big thing now in North Africa, the Middle East, and Pakistan. Everybody else has abandoned the practice because they care too much about the welfare of any future children. I thought it would be worth talking about this. It was the advertisement for the close relationship marriage nurse, which was forwarded to me by one of my correspondents that prompted me to speak on this matter. It's a situation which, by the way, is getting worse rather than better. Still, there it is.